Thank you for watching another video today on Money Madness. My name is Blair. Please like, subscribe, and comment, and help me to get the word out to some new people. I mean, the more people that we can educate, the better, right? And I like to entertain a little bit. I hope I'm entertaining, but mainly I'm about the education. I want to help people to learn something. So today, the topic I want to cover, and this is a very big topic, so I'm going to have to make it short, is Medicare. And Medicare is our nationalized single-payer health care plan through the government that we have in America. And there are basically four types of people that are eligible for Medicare. It's when you turn 65, so it's a matter of the age. If you turn 65, you're eligible. Also, if you have been on Social Security Disability Insurance, which is SSDI, for 2 years, and in your 25th month of being on SSDI, you're eligible for Medicare. Also, those that have Lou Gehrig's disease and those that have end-stage renal disease. And there are some residency requirements and things like that. But for the most part, those are, really the majority is, those that are 65. So let's go over the basic parts of Medicare in a nutshell. And there's a lot to this. And I've been in the Medicare industry for several years now. So I feel like I understand it pretty well. So Part A of Medicare, Part A is in Apple, is your hospital insurance. And that's going to cover your stays in a hospital. And it also, it can cover skilled nursing and hospice and some other things. But it's mainly for when you go into the hospital. And Part B, as in boy, is for medical coverage. I just like to call it doctor coverage because that's basically what it is. Another thing about Part A, I forgot to mention it. Part A is inpatient. So if you can remember that Part A is when you're an inpatient. Part B is in boy is when you're an outpatient. Okay, and Part A and B, that's what's called original Medicare. It used to be all there was back in the 60s when it was first passed. And if you have your coverage, well, we'll get into that in a second. Because you can either have your coverage you can either be insured by the government with Part A and B, or let's get into Part C. C is in cat, and that is a Medicare Advantage plan. And Medicare Advantage is when you still have to have Part A and B, but while you're on a Medicare Advantage plan, you are insured by a private company. So the choices are you either, sorry, my nose is kind of itchy. You can either be insured by the government directly, and that's Part A and B, or you can have a Part C plan, as in cat, Medicare Advantage, and you have to have Part A and B, but you're actually insured by a private insurance company. And normally these plans are either an HMO or a PPO. There are other types of plans. HMO is a health maintenance organization. PPO is a preferred provider organization. Part D is in dog is a prescription drug coverage. And this was passed, I think, in 2006, somewhere around there. It didn't used to be, and they added that on. So that's where you can get your prescription coverage. And you're either going to have, maybe I should go into that now. So there are two choices with Medicare, two paths. You can either be insured by the federal government with Part A and B directly, and then normally you would have a supplement. I'm going to talk about those in just a second, and a prescription drug plan standalone. So you would have A and B, supplement or not. You could take your chances and not have a supplement. I wouldn't advise it. And then a Part D prescription drug plan. Or you can get your Part D prescription drug coverage through a Medicare Advantage plan, Part C. So I know this is kind of confusing, but just remember, Part A, hospital coverage. Part B, doctor coverage. Part C, Medicare Advantage. Part D, drug coverage. And there are two paths. You kind of have to choose, when you first come on to Medicare. You want to either have A and B and a supplement and a prescription drug plan, or a Medicare Advantage plan, which almost always includes drug coverage. So those are kind of the two ways to get Medicare. And then the last thing, this is not a part of Medicare officially, but supplements or Medigap. And what those do is Part A and Part B, they cover a lot, but they don't cover everything. Especially Part B, there's a you pay 20% of whatever's the amount is, and that's unlimited. So that can potentially bankrupt you, or go really, really high. And the supplements normally will cover the things, at least quite a few of the things that Part A and Part B do not cover. But remember, if you do A and B and a supplement, you want to get a prescription drug plan too. And then let's see, what else can I tell you? So yeah, normally it's just, if you want to pay more in premium, well, no one wants to pay premiums, but if you don't mind paying more in premium, and then when you go to the hospital, when you take an ambulance, when you go to the doctor, if you have original Medicare and a supplement, normally you're going to pay less. So do you want to pay more in premium and less when you get stuff, or do you want to pay less in premium with the Medicare Advantage, and then pay co-pays, pay co-insurance, pay deductibles? And then another advantage of Advantage is that I think every plan that I know of has a maximum out of pocket. So it might be high. It could be as high as $7,000, $8,000, $9,000, $10,000, something like that. But at least your costs are capped per year. Whereas if you just had Part A and B, it's potentially unlimited if you don't have a supplement. Oh, I feel confused just talking about this stuff. But anyway, just remember, Part A, hospital. Part B, doctor. Part C, Advantage. Part D, prescription drug coverage, and then you have supplements. And to make it a little bit more confusing, they go by letters, like Plan F is in Frank, Plan G is in girl, Plan N is in Nancy. And that's just a broad overview of Medicare. I hope that has this is in America, this is our single payer healthcare system that we have. I personally, my opinion is I wish we just would have Medicare for all. I wish we would expand the Medicare program and just cover every American. And that would cost money. You'd have to pay taxes, but we're paying all these premiums. We're paying all these co-pays, all this co-insurance, all these deductibles, to private insurance companies. So anyway, that'll maybe never happen. But I think I'm glad that we have Medicare for those that do qualify for it. I think it's a good program, whether you have original Medicare or Medicare Advantage. Okay, thank you for watching my video today. God bless, and I hope everyone has a great day.